with that being said, although we have tremendous value, we have the numbers, we have the trust, we have all these aspects that add to our value, there's a series of challenges that the nursing profession face that doesn't allow us to utilize this great potential to its full extreme. And here we have a sampling of some of the major challenges. And I say that this is a sampling because it's not an exhaustive list. These are just some of the current issues that we encounter in our profession. One of these is the nursing workforce issue. We have nursing shortage. I have a question mark there because we are seeing temporarily that we are currently at this point not experiencing a shortage or as an extreme shortage as in the past. But most experts will tell you, and those that have made projections, that we will be out of this temporary fix and that we soon again in the future will encounter severe nursing shortages, more severe than what we have seen currently. And this is a phenomenon that we just don't see here in the US. It's actually a global phenomenon where we're experiencing this shortage. The other nursing workforce issue that we have that is very major is the issue of lack of diversity. The biggest lack of diversity that we have is in regards to gender. So we have, less than 10% of the nursing workforce are males. We see that trend changing a bit. We see that it's a little bit higher, about 20% in nursing schools that are males. So that trend is definitely changing, but we are far away from reaching that 50% mark. We also see little demographic diversity in regards to race and ethnicity, and I'll show you a little bit more and discuss that a little bit more in a minute. We also have inadequate levels of education. So we are one of the few, if not the only, health profession where you can enter through different pathways of education. So you can get a diploma, you can get an associate's degree, or you can get a baccalaureate degree. And the proportions of higher level educations of these threes are not where we would like to see them. We also have a small proportion of the nursing workforce that continues to get their graduate degree, that continues to get a master's, a PhD, or a DNP in nursing or related health disciplines. And that has a major impact on the nursing shortage as well. We know that one of the issues why we face a nursing shortage is not because there's not interested or very eligible candidates that want to enter the field. It's because the schools of nursing don't have the capacity to teach those individuals that have interests. And one of the things that limits this capacity is having nurse faculty that have a master's or doctoral training to be able to serve as educators. We also experience barriers to practice. And we experience barriers to practice on all levels, but it's most evident in the area of advanced practice nurses, where we see that there's fluctuations in terms of scope of practice and laws in different states that allow nurses in some states to practice to their education and training, and nurses in other states to practice to a level less than what they're prepared to do. And that's a major issue. And then another major issue related to barriers to practice is the insurance and reimbursement issue. A lot of times nurses are unable to be reimbursed directly for the care that they provide. They have to be reimbursed through physicians or other mechanisms. And then lastly, which is perhaps one of the biggest issues that we have in the profession, is the lack of visibility of nurses as leaders. Nurses have the knowledge, they have the expertise, they have the numbers, they have the respect. However, they're not perceived by the general public as influencing health and designing and redesigning health, and that's a major problem. So I'm going to show you a series of graphs that sort of reinforce some of these issues that we've been discussing. Here we have the distribution of registered nurses in the U.S. By population and race, and you see that the red line is the U.S. population, and the white line is the RN population. If you look down here at the very bottom, you'll see that the white non-Hispanic are overrepresented in nursing. And if you look here at Black, African American, non-Hispanic, and Hispanic, Latino of any race, you see that they're vastly underrepresented in the nursing workforce. This is a shocker to most people in the general public, where they perceive nursing as being very highly diverse, when in fact it really lacks a lot of diversity. For example, Hispanics are about 16% of the current population, however, just 3.6% of the RN population. What we're seeing is that the trends are that nurses are becoming more diverse. However, in general, this proportion of Hispanic nurses is remaining stable, so we have a lot of work to do in that area. Here are the number of basic RN programs by type, and what you see in the black bar graph, or in the blue actually, is the number of associate's degree programs. The yellow or orange looking one is baccalaureate degree, and then this one on the very bottom are diploma degree. And what you see is through time, the diploma degrees are, lowering in terms of the number of programs that they're providing, and that consistently the associate degrees are on top. Both the baccalaureate and the associate degree programs are increasing in numbers. Here we have a map of requirements for physician-nurse collaboration by state. And so what you see in the purple are the states where the nurses are able to practice according to their education and training, meaning here they're looked at as having expanded roles in these states. And the blue states are where nurses are not allowed to practice according to their education and training. So with that, what I mean is that advanced practice nurses are trained to diagnose independently, treat independently, and do a series of things independently. And in these blue states, they're not allowed to practice independently. They have to have collaborative agreements. Collaborative is not the appropriate word. I think it's more of a supervisory agreement with a physician to be able to practice. And this is such a good example of how evidence does not inform policy many times. The evidence is very clear. There's been a number of very rigorous randomized control trials, meta-analysis, comparing the care of advanced practice nurses to primary care physicians. And what we find in those studies is that the care is comparable. There's no difference in safety, there's no difference in quality, etc. If there is a difference, then it's a slight advantage for the advanced practice nurses in regards to patient satisfaction. But that is the only difference, and that difference, is supportive of the important role that advanced practice nurses play. And so, regardless of the clear evidence, there's many states that don't allow nurses to practice to the full extent of their education and training. And that's a shame, because we have this great resource that it's not being used to the full potential, and we as a country are in desperate need of this. The other thing that I think is important to note is that if you look at the map, there's no rhyme or reason to why some states are blue and some states are purple. It's not the Democratic states that are purple and the Republican states that are blue. You see a lot of states that tend to be Democratic that are purple or blue, and the same with the Republican states. So it has nothing to do with the political agenda in terms of party affiliations. This is a bar graph depicting opinions leaders' prediction of the amount of influence nurses will have on healthcare reform. And what you see here is that nurses, after patients, are at the very end in terms of being perceived as having a great influence on healthcare and healthcare reform. So now that we've talked about the value and we've talked about some of these barriers that we experience as a profession, let's move on to talk about the future of nursing. And I'm mostly going to focus on the Institute of Medicine report on the future of nursing, which was titled The Future of Nursing, Leading Change and Advancing Health. Let me just give you a little bit of background of this initiative. So the Robert Wood Johnson Foundation, which many of you know has been a long-standing champion of nursing, has funded a lot of these innovative nursing projects that have served as models that have been disseminated, approached the Institute of Medicine to take on this challenge of looking at what the future of nursing would be within a reformed healthcare delivery system. This was done a few years ago, and the initiative began a few years ago when we were in the active healthcare reform debate. And the committee was tasked with producing a blueprint of what that future would be, what the future of nursing would be, considering that our healthcare would be different, our healthcare system would be different than what was currently the state. And actually, during the time that the committee met and was putting together the evidence and evaluating these issues and developing our recommendations, healthcare reform was passed. And so this resulted in a projection of having 32 million additional Americans that would have insurance and therefore would be expected to be accessing healthcare. And so with nurses being the largest in terms of number, and I would add, in value, importance and value as well, then nursing was seen as a great opportunity of being able to respond to some of this increased demand in healthcare that we will be experiencing in the future. So this initiative came from the Robert Wood Johnson Foundation, but the study and the actual methods and the way that this was conducted was according to the standards of the Institute of Medicine. And I think that was very important because the Institute of Medicine is a very respected medical organization and has benefited for many years in terms of really being respected in terms of what they say. They're viewed as a non-biased expert organization, and their recommendations have traditionally had a huge impact in determining policy and change in healthcare. So the committee was put together by the Institute of Medicine and utilizing their standards, and they put together a group of individuals that was very interdisciplinary. So they didn't want to have a group of just nurses. Usually what they do in the IOM is that they make sure that whatever topic they're discussing, that just a minority of the individuals on the committee are from that area, are experts in that particular or represent that area. And the reason for that is that they want to make sure that the recommendations are not self-serving. So at the beginning, a lot of the nursing organizations were upset at the fact that there was only 6 nurses on the committee. There was also physicians. There was, as you can see from the list here, there was experts from all over, from the economic side, from insurance side, from the business side, from public health. There was also, as I mentioned, physicians. There were dentists on there, social workers. And so they represented different perspectives. The chair of the committee was President Shalala, which is the president of my university. And that was a key strategy because she has been the longest serving Secretary of Health and Human Services and has just such great and deep knowledge in terms of how to influence change and who are the key actors. And so she was able to direct the committee and in directing us in identifying, when we develop these recommendations, and identifying specific individuals, organizations that we can hold accountable in terms of implementing and directing these recommendations to. So that was very important. And the vice chair was a nurse, Linda Burns Bolton, who's a leader in nursing. She's the VP of Cedars-Sinai Medical Center, which is a very respectable healthcare institution, and she's been the president of various nursing organizations, including the Black Nurses Association and other very important large nursing organizations.